Morning, everyone. I'll just introduce myself. I'm Joe Neglia. I'm the department head, and I'm a pediatric oncologist. And every year we save we pull one grand rounds out for a State of the Department talk. So we'll kind of do that today. All right. So I have no relevant financial relationships for this talk other than I get my salary paid in part because I do this. We're not going to talk about any investigational use of anything else. And this is what we're going to do. I thought it'd be good to just review some of the highlights of 2016, some reporting based on our clinical outcomes, research, education and research, some of our ongoing initiatives, and then save some time at the end for questions. So we'll try and get the talk done in about 45 minutes and have some time there at the end. So in terms of highlights of 2016, and I'm talking about not academic year, but the calendar year, because it's a little easier for us to get a handle on. I want to go through some of the new faculty, philanthropy, events we had, and some recognition for the hospital. We had a lot of new faculty join us in 2016. So it's great. The department is continuing to expand. We added in pain. It's the first time we've had a dedicated pain physician here in our group. Sophie and Larissa in emergency medicine. Craig Byerly joined the infectious disease division. Paula Brito as a new hospitalist. Brian Joy joined us as the head of the CVICU, coming from Nationwide Children's, and Jeff DeMar came also on into the CVICU. Sarah Kisselbach joined in nephrology, Walid Maloui as a hospitalist, Jen McVean in endo, Risha Moskowitz also in emergency medicine, Rennie Pierpont in neuropsychology, Mona Riscala in rheumatology, Nathan Rogers, Justin Ryder, Miriam Shapiro, Beth Swanson, and Knudsen. So we actually had a really great group of people joining us, many coming out of our fellowships, but many actually being recruited from outside the University of Minnesota. Dr. Furnival. Did he start in calendar year 16? Uh-oh. What? Huh. All right. Is he getting paid? Yeah, probably. Okay. This is a list I got from Levon, so okay. All right. We'll add him later. We did have some losses as well, and you know, it's not fair to talk about gains without talking about losses, and some of these really have hurt. Alan Blyberg has moved on. Amy Calhoun decided to move back to Iowa. Tisha Deminahali is up in Duluth now with her husband. Joe Mangione has gone. Anna Petrick from endocrine left. So did Puying Eurotam, and then Mike Veneris left as well. Mike became head of the bone marrow transplant program at Denver, so it's a step up for Mike, and we wish him the best. Puying is in Malawi and actually was emailing us over the weekend about a possible Fogarty grant. So some people leave and some people stay connected. So 2016 was a very big year in philanthropy and events for us. And philanthropy is obviously an important part of what we have to do as a department as we try and maintain a resource here to fund our research and our educational activities. You know, anybody who's read the paper is seeing that the NIH is now just praying that they don't have massive slashes in their budget as opposed to hoping for increases in the budget. So philanthropy is going to become more important for us being successful down the road. And we are very fortunate in that we have some really talented people raising money for this department. I saw Elizabeth Patty come in. Elizabeth leads the children's group at the University of Minnesota Foundation. But has a number of people, very, very good people working with her. In terms of gifts, $1 million this year, again, for the Kids First Fund. This is focused on Fanconi anemia. All this money is not coming to be used at the University of Minnesota, but it does come to us to support FA research around the country. The Fred and Catherine Anderson Foundation for their support of pediatric cardiology. The Hedberg family has been great supporters of our brain tumor program, came through with additional funds this year. The Zach Sobiech Fund. Zach was a young man with osteosarcoma, a very talented singer and composer. And this essentially money from his trust continues to come in. We had new gift, a very nice gift this year from Fran Savigno that we're able to put forward to the General Pediatric and Adolescent Health Division to help support their work. ALD research, the Hubbard Resident Wellness Fund increased, another $90,000 from the Otto Bremer Trust. Last year I talked about the Otto Bremer Trust supporting the child abuse program to the tune of $2.5 million. This year the same trust came in with an additional $90,000 to report Rebecca Schlafer's work in the Minnesota Prison Doula Project. So anyway, great research and gifts. Great corporate engagement here. You look at the lobby, there's always something happening out there. Had Boston Scientific in, Verite Group, more Boston Scientific, Love Your Melon's been here, Target, Optum Health, Cause Marketing Partners, go drive a BMW in a certain month and they'll give us $1 or whatever it was, I can't remember, $1 a mile you drive. Chili's does a fundraiser every year for us. Papa John's, Cub, Caribou have all been great support. So this has been good. The Masons have continued to step up, and this year we started something called the Masonic Mission Award. These are opportunities to recognize great care, great efforts by staff as well as faculty, and the winners this year included Josie Fisher, one of the nurses on the fifth floor, Caitlin Millman, Megan Breshnan, and Dr. Rhea Rowe, one of the pediatric ophthalmologists, actually the first physician winner of this award. We had an interesting event in April of last year. All of a sudden we got a end of the day call that there was a bus tour coming through from the Cohen Foundation, Stephen and Alexandra Cohen, and Dan Saltzman happened to be the person available to help with this tour that showed up. These people were on a bus touring the United States, seeing hospitals and children's programs that they thought might be worthy of investment. And for some reason they ended up here. They gave us, 8 hours or 6 hours of notice to get a tour together of the children's hospital. Ended up giving us an adopt-a-room on the fourth floor of the building. So it's really hard to know how these things are going to play out. You just have to essentially be ready to do it at a moment's notice. Wine Fest is coming up. This is last year's great event held down at the Depot. Wine Fest is our biggest fundraiser for the department every year. So if you've never been to Wine Fest, tickets are out there right now. There's a great event on Friday night, a tasting event, and then a more formal dinner on Saturday. Champions for Children's Golf continues every year. These are normal-sized people. These are Minnesota Viking people. It's really, really weird to stand next to these guys. But anyway, this is a great program. Kyle Rudolph, I want to single out, and you'll see later on, he's become a great supporter for this hospital. Kids First Fund has netted over $4.5 million to date. That's Dr. McMillan looking like $1 million because she got $1 million that day. So she was down at Florida State, thank you, Florida State University, where, unfortunately the coach does have Fanconi's anemia and has become a big supporter of this. The UMF Foundation reached $1 billion in 2017. $240 million of that went to children's health. That includes capital improvements here at the Masonic Children's Hospital, but as well as over $100 million to support the research activities in pediatric health here at the university. The Legacy Luncheon was held in October. This is Dr. Joe Sokolowski. Joe was is a pediatric endocrinologist, worked for many, many years at Children's Hospital of St. Paul, directed the education programs for Children's Hospital of Minnesota, and Joe was a gold-headed cane recipient for this year. This is Dr. Robert Fish, one of our emeritus faculty of the department. Robert actually has been nominated for a President's Award from the university this year for his work really in talking about his family's experience in the Holocaust. On the same day as that, we had the 30th anniversary of the Adoption Medicine Program. We had Senator Klobuchar there. That's Mark Rosen, the announcer from sports announcer, Dana Johnson, Judy Eckerly. A great event recognizing another outstanding program. Alan Schumann came. He was retired CEO of Ecolab. He's been a great supporter of Alpert's research here for the nephrology division. This is the Fred Savigno and Ted Risdall. Person I don't recognize, but this is the family. This was a fund set up in honor of Fred's brother, Michael. Fashion Fest, November 18th. This is something that sells out every year. If you want to go to it, you need to be aware of it because they don't advertise it. It's just like gone instantly. And then a lot of visits from the Minnesota Wild, Cub Foods, the Vikings, Kevin Warren, who really should be called out. He's the chief operating officer of the Minnesota Vikings. He's really taken on philanthropy for this hospital and our programs in a big way. And Kevin actually started the Carolyn's Comfort Fund with a donation of $1 million to support families here whose children are here with serious illness. And Kevin has also taken on hosting dinner on Thanksgiving and Christmas. And this is not the Minnesota Vikings hosting it. This is Kevin hosting it for the entire hospital. A really amazing man. As I mentioned, we have new spaces coming up. If you've tried to get on the 5th floor lately, you'll notice there's a lot of construction. That is for a wellness center that will include space for exercise, a salon chair, just something where the parents can go and get a little relief. Kyle Rudolph, the tight end for the Minnesota Vikings, is leading an effort to actually refurbish the entire original gift shop just on Riverside Avenue there into something called the End Zone. This will be really focused on our teen, young adult population, a place for them to go during prolonged hospitalizations. And we're working with iHeartMedia to open up the area adjacent to the chapel now for a media lounge. So lots going on in philanthropy, and really thanking Elizabeth Patty, Christy Flanagan-Villar, and all that group for everything they do. In terms of the education program, again, lots going on the residency, EPAC, the Department of Health, and a new physician scientist training. So we hit a new high in applications last year to the residency program, over 1,000 applications again. So it's been about flat for the last few years. This is what the department heads are now calling match frenzy. There seems to be a burning need for medical students going into pediatrics to rank about 20 or 30 programs. If you're actually a good medical student or even an average medical student, you probably don't need to rank more than 8 programs. Because by the time you've ranked 8, almost everybody's in. But we are seeing this push for a large number of applicants, and it's a real challenge. Number of applicants from U.S. grads, 526, 529 from international graduates, had 18 applicants from our medical school, and interviewed a total of 191 residents. So really thank you to everybody for the work in getting this done. This is a huge undertaking every year. This is our incoming class. Again, we have 4 residents that are joining the education in pediatrics across the continuum program. Aaron Shane, Matthew Thompson, and there should be one more, Leah, all joining EPAC. George Christopoulos from the University of Athens is the first resident to match in on the physician scientist training program. And then Khalid Muhammad from Asuat University, the International Immigrant Medical Graduate Program. So program continues to not only be strong, but is very innovative in doing new things. So the residency is completing its 4th year of academic half days. This is block ed. This is the thing that happens on Fridays when all the residents, the fellows and faculty go crazy because the residents all leave. But it's actually been a very good program in terms of resident education. There is active fourth year of our quality improvement boot camp for residents. We are doing teaching and learning communities now to actually have sort of a continual mentoring relationship with residents. And really, our residency program continues to stand out across ACGME for the work it does. And Emily Borman-Shope and everybody in that program should be recognized for their work. EPAC is continuing. We've talked about this before. It's a competency-based variable time to advancement from medical school. And the first cohort is all transitioned. This group of men and women transitioned actually early, between August and December, during what would have been their fourth year of medical school. So they're starting the residency a little bit earlier. Second cohort was selected in January 16, and the third cohort has been selected now. The program's incredible in terms of real-time mentoring, real-time feedback that these students receive. And it's something that we're trying to understand how to actually generalize to all of what we do here. And Patty Hubday and others are working hard on this. But it is a great way to get feedback quickly to the residents. It's basically done off iPads. It's a series of short questions. It's real time. It's not, sitting down 3 weeks later and trying to remember who you were on service with and then filling out the form. It's a very good way to do this. In terms of the Minnesota Department of Health funding, we again received money for primary care expansion. This allows us to take another resident and focus this on somebody doing primary care. The International Immigrant Physician Grant Program continues for another year. This allows a graduate of an international medical school, a physician, not a physician in training, but a practicing physician who's had to relocate from their country to come to be in the United States and start down a path towards practicing again. These trainees not only commit to doing a residency, they then commit to 5 years of primary care service in the state of Minnesota after that residency. So that's an additional $1.2 million into the program. Physician scientist training pathway, this is something Bryce Binstad has really led and done the heavy lifting on. So it's an applicant with an advanced degree or significant prior research interested in pursuing both residency and fellowship here. And this allows them to participate in accelerated pathways to fellowship. And by going up a person in the residency program, we can do this without compromising the other rotations. So like I said, our first year we did this and we were able to match an MD PhD applicant. So excited to be able to do that as well. On the clinical side, I just pulled what we talked about last year. What did we think we were going to do this year? So we listed 5 things. We felt it was important to rebuild the CV surgery program. We had been through a tough time. Jim St. Louis had left. We're just getting the program rebuilt. The census in the CV ICU was down. It was a challenge. We said we were going to do that. We needed to improve our maternal fetal medicine and neonatology positions in the region. We were just opening up the birthplace, the new birthplace up on the 7th floor here of the hospital. We had already built out the 11th floor of the East Building for the additional NICU beds. We needed to resume our focus on our bone marrow transplant and solid organ transplant programs, build on the success in the ED, and lastly, move our clinic, our St. Paul clinic, out of the Nassif Building next to United Hospital and look for a better place for it. So, in terms of rebuilding CV surgery, Tony Izaki joined us in February of 2016. Tony's the pediatric heart surgeon. Brian Joy joined us in 2016. Brian came to us from Nationwide Children's Hospital, where he was on the faculty. He's double boarded in cardiology and critical care. Since Dr. Izaki's arrived, it's actually more than 150. It's probably more than 180. We're probably getting closer to 200. Looking at Brian, close to 200 cases so far. 30-day mortality of 0. This probably is it's like got to be the best in the nation because you couldn't be better. And one death so far in the program, at least last time I was aware of it, and that was a death from infection. So that program has grown again. Zaki's a great surgeon, but great surgeons need great intensive care units and great cardiologists, and none of this is happening without a huge team effort. We felt it was important to improve our maternal fetal medicine position and leverage the new birthplace. So we have our 13 new beds on the 11th floor of the East Building. The NICU is commonly in the low 50s, occasionally it's exceeded 60. The NICU census when I looked this morning was 59. So they are very, very full. This is great news, but this news has really put the NICU physicians under a lot of stress, and we added a third team, essentially that's in charge of the 11th floor, that to the rounding group, because it's just not possible to round on 30 NICU babies a day. It may not be possible on 20 really sick NICU babies a day, but they're doing the best they can. Our North region has continued to expand. We have NICUs here. We have the NICU that we run at North Memorial. We also run the NICU at Maple Grove, as well as Ridges and Southdale. Over the past year, the NICU at Maple Grove has continued to grow. They are up to, 32 beds and are going down to 28 weeks, or are they at 24 yet? 28 weekers? Yeah, so still at 28 weeks. So that NICU program is continuing to grow, and that's growing with the program at North being relatively stable. So we have 6 neonatologists rounding in the North Metro, as well as the team rounding in the South Metro, and then 3 teams here. So NICU has been very busy. With the Fairview Health East connection now taking shape, we're going to have to understand over the coming months what that means to us in terms of our commitments in neonatology across the Health East system, where they do have NICUs at St. John's and at Woodwinds, I think. So not big NICUs, but they do have NICUs. So more to come there. We wanted to continue our focus on bone marrow transplant and solid organ transplant. You know, we are known nationally and internationally as a transplant center in both of these. All in all, I think we did okay in 2016. Our BMT volumes were essentially stable in 2016 from where they were. We did have some increase in our solid organ transplant program. Our kidney transplant program continued to rebound, continued to do very well in the pancreatectomy auto islet cell program. BMT volumes have really taken off again this year, though. They're on a clip towards 100 transplants in 2017 when we last looked at the data. So that program is expanding. We're working closely with Fairview to develop outreach. This has become more and more competitive over the years. More and more places are opening up transplant centers. You know, a lot of people we've trained have gone elsewhere to do this work, and it's challenging. So this has to be a partnership with Fairview to actually get this thing done. The emergency department, we wanted to continue to grow and to start leveraging the success of the ED program. This is one of the most amazing growth graphs we have here. This is the program in 2005 and 2006. About the time I think Mark and Ron were recruited by John Schreiber to come lead the program. So 1,900 kids seen in the ED in 2006. This is the opening of the Children's Hospital in 2011. You can see we're already on a rapid rise. And in 2017, we are continuing to, 2016, we continue to grow, topping 14,000 visits in the emergency department. 775% increase in the program. It's been busy, and we've tried to keep up with recruiting faculty to run this program. It's been a challenge. Despite the challenges of this growth, the ED has performed very well. Carrie Schneider was named one of the rising stars this year. Ron and Mark were both named top docs, so I'm missing an apostrophe there. That's Robin's fault. The academic role is expanding. Pablo Avendano has recently received a grant to work more on bedside ultrasounding. They are hosting a safety and emergency care conference here in the Wilf Center on June 6th. And in spite of the volumes, this continues to be the top site, really the top site across all of Fairview in terms of patient satisfaction. And I have never heard from a family that's gone through our ED that's not called, nobody calls to complain about the ED. They actually call to thank us for the ED. So it's pretty amazing. We said we were going to move the clinic to Woodbury, and we moved to Woodbury. This is I-94. This is where the clinic is. This is where Sam Gupta lives. It's really convenient. We're going to start having Sam do patients in clinic now. But no, this is a great spot. Tamarack Road here is right between, we sit right next to Central Pediatrics and just across the parking lot from a Partners in Pediatrics clinic. This is the exterior of the clinic. This has free parking at the door. This is a nice thing. It's a community-based clinic, so there are no facility fees. That little door is going to haunt us forever, and that has now been moved over here. This was the one that I think was down there in sedation 10 years ago. Exam rooms, we have exam rooms. We have a zip line. So the big part of that space is dedicated to pediatric rehab. So they have a very nice rehab program there, including a zip line for the kids in terms of strength training. Also, on the clinical side, we're ranked in U.S. News in 4 specialties this year: neonatology, gastroenterology, nephrology, and pulmonary. So congratulations to everybody there. Department revenue is another way to look at the success of the clinical programs. We continue to do well, topping about $48 million in revenue last year. These are the revenue benchmarks over the last 5 years, so they have continued to grow. I wish that this meant we had an extra $12 million available, but we've had to actually hire people to do that work. So there are costs involved in raising more money. On the research side, how am I doing here? On the research side, we've continued to do well. A number of highlights here. 89 new grants or competitive renewals successfully competed in 2016. 54 across 54 unique PIs from 15 different divisions. So research is not the province of 1 or 2 divisions here. This is 15 out of 16. New federal funding, Milena Bellin, remarkable funding, 2 new RO1s in 2016. Troy Lund, a new RO3, Marla Eisenberg, a new R21. Iris got her T32 renewed. Congratulations. These are big deals and challenged to get renewed. Brandon Moriarty, a large Department of Defense grant. Tom Bastian, an F32, and then David Largaspada renewed his, or a new U54. So really great performance there across from everybody. As you can see, we've managed to maintain our sponsored revenue at about the same level since 2012. So this has not gone up at the same pace our clinical revenue has gone up. This is something that we do need to focus on a little bit. So this sponsored revenue does not include the CTSA grant, and we'll see the impact of that grant in the next slide. So this is our NIH Direct and Indirect. This comes from something called the Blue Ridge Institute, where they compile this data for medical schools and hospitals across the United States. You can see in 2009, 2010, we're running about $12 million in NIH funding. In 2011, all of a sudden, we're up to $25 million. Well, this is the CTSA effect. So Bruce Blazer is the principal investigator of the CTSA grant, and as you can see, that grant was what was pushing us into the top 10 in these past 5 years. So this year, our ranking fell to number 15, puts us right here between Mount Sinai and Wash U. Not necessarily bad company, but not where we have been. Having the CTSI grant would have put us back into the top 10 again. So that grant is actually under review again now. We're very hopeful we'll get it refunded. But I think one of our challenges is going to be to, over the next years, to actually look at how we expand this number and let our ranking rise independent of the CTSA grant. And I think the only way we're going to actually do that is through recruitment. It's probably, I could tell Milena, would you hurry up and write your third R01? But, it's getting, I think we're pushing our faculty pretty hard, and they're being very successful in a tough time. And it's going to be a tough time, I think, over the next couple of years. So, challenges on the research side, returning to the top 10 without the CTSA, this would require an additional $5 to $6 million of direct and indirect awards. So that's going to be probably 10 to 15 new R-level type grants. So that's why I'm thinking that's going to be hard to pull off without additional research faculty. So recruitment of new investigators is going to be really important. We need to retain the outstanding people we have. If you're successful in NIH funding right now, there are lights that go on in everybody's medical school across the country saying, hey, we should talk to him, we should talk to her, we could use this person. So, we end up not only recruiting, retaining is a big part of the strategy. We also need to look for new possibilities. One of the, not on here this year, but there is for many years, the University of Florida was right up here, South Florida was right up here at the top, driven by a cooperative group award that goes to the University of South Florida. So essentially all the money that was funding some of the big endocrine collaboratives went to the University of South Florida. They didn't really do, millions and millions of research there. $8 million is a huge amount of money, but they parsed it out. We have other programs like that, but I think, a good example is Chet Whitley's Lysosomal Storage Disease Network program comes here. So other opportunities like that are important as well. Other initiatives from last year. Pediatric grand rounds. So this is a success. I mean, you can see our average attendance over the past 4 years was running in between 35 and 40 with nudging and, cajoling. We were able to get up to 40. Since we changed the time slots, we're running over 70 people attending grand rounds. And this is great. I mean, we have more residents, we have more faculty, we're getting more non-MDs coming. So this has been a great thing. And I really hope you continue to encourage your residents, your colleagues to come to grand rounds. You're going to hear some facts and figures from me, but most weeks you're going to get some great talks. And it doesn't make any difference whether it's in your subspecialty or not. The talks are fantastic, and you learn a whole lot. What are we going to do with the Masonic Gift next year? So what are we doing what are we going to do with that $1 million we get? We're still in a phase where we're getting $1 million annually from the Masons. That money is not just to support the Department of Pediatrics. The money is to support research in children's health across the University of Minnesota, and we're actually trying our best to live up to that mission. So we're investing in early investigators again, and the recipients in 2017 are Tate Gislin, who's a neonatologist investigating inflammation during pregnancy. Rebecca Schlafer, who's also, like I said, receiving funding from the Otto Bremer Foundation, looking at the impact of maternal incarceration. And then Jed Ellison, who is actually in the Institute of Child Development in the Center for Neurobehavioral Development Research. Jed is investigating neural pathways of children with autism, and is actually somebody who is jointly appointed in this department, and really is a great person to add to our focus around neurodevelopment and autism here. So Jed's going to do an outstanding job, and he's going to receive support through the Masonic grant for next year. Program development. We had focused on the 0 to 3 brain initiative for the first couple years of this grant. Dr. Krapina was leading that effort. We'd also focused money in on the role of essentially newborn stress and prenatal events on neurocognitive outcomes. We're going to start to focus in childhood obesity, and Aaron Kelly, Justin Ryder, Claudia Fox are leading that effort right now. So we're looking actually to add people to this group. We've added Megan Oberle, a pediatric endocrinologist coming from CHOP, right? Who is going to be doing pediatric endocrine, but will also be doing some time in food safety and nutritional safety with this group. We're looking for more. There are more children that need this program than we're able to see by a long way. And again, this is not a program that's going to focus on the moderately overweight child. The work that Erin, Claudia, and Justin are doing are really focused around kids who have BMIs that are in the 35 plus range. These are kids that are dangerously obese. They're going to have liver disease, they're going to have diabetes, they're going to have all sorts of problems if we can't alter their life course. We're going to continue to support the work of Brandon Moriarty. Brandon and his group made a very significant discovery in osteosarcoma that was leveraged to this new Department of Defense grant in 2016. At the recent Children's Oncology Group meeting, we were yet again informed that there is going to be no new osteosarcoma research protocol nationally because nobody has a good idea. So this is pretty sad, actually. We're creating this with the same drugs and almost the same schedule that we were when I started my fellowship in 1984. So Brandon and David Largespot are looking at new targets and hopefully are on to something because we desperately need new ideas and new drugs in this disease. Cross-departmental grants are out. We've committed $200,000 from the Mason's Gift in both 17 and 18, so there will be $200,000 grants. The RFA went out in February. We've had over 30 letters of intent and applications, and Dr. Panaskaltis Mortari is actually the Vice Chair of Research who is leading this effort to get these things reviewed. Again, these are the core of this was it had to be cross-departmental. It could not just be Department of Pediatrics grants. So we're excited about these. The first three awards have done very well, and continue to work through this. The other initiative that got launched here in the last year is really a focus on development and diversity. So Tony Moran is leading this effort. Kathy Bendel is leading the diversity part of this. This has been a very active work product. These are just some of the things. So 4 developmental workshops have been held for assistant professors and 2 for associate professors. We've already had 1 grand rounds focusing on this. We resumed the faculty recognition event, and we've named it in honor of Julie. That happened in January. We're going to do that every other year. Mike Pitt's P-Quad has been instituted for assistant professors. This is essentially a positive peer pressure publications. I can't remember what all the P's are. We're really working together to drive each other, to get the abstracts out, to get the abstracts turned into manuscripts, and it's been successful. I mean, last year at PAS, I don't know, we had 10 or 11 abstracts out of the emergency medicine program. It was really, really nice to see. We focused on the assistant professors, honing in on academic focus and mentors. Also associate professors have been paired with mentors. We've supported 6 faculty to attend national leadership meetings. There was a burnout survey conducted. The results are going to be presented in the fall. Recently, a document called the Guide for Pediatricians and Scholars, essentially a how to get things done document has been created, and that will be rolling out. And we really didn't have much to do with this other than complaining, but there have been improvements in the physician's lounge, so it's a more pleasant place to be right now than it's been in many years. In terms of the diversity, faculty equity, diversity, and inclusion, 17 faculty have formed a committee on this. They've drafted a diversity plan. We have 2 grand rounds this year on diversity and equity topics. Implicit bias training is required for all department leaderships. All of the vice chairs actually had to take this last year. We'd like all of our division heads and fellowship directors to take this as well. Partnering with the Office of Diversity on initiatives around No Hate and We All Belong. Kathy Bendel was appointed to the Diversity and Climate Expert Panel. That's going to help make recommendations about how to increase this across the medical school and AHC. And we're also developing a website resource. Integration updates. This is the other thing that started up in 2016 in earnest again. So we are definitely talking with Children's Hospital of Minnesota. It's not just the Department of Pediatrics. This is essentially a discussion that's going on with three major partners here: the medical school, the Children's Hospital, and Fairview and UMP. So all of us are discussing the possibility of creating a new independent academic children's health system for the state of Minnesota. If we can pull this off, if we can live up to our ideals in this, we're looking to create a system that would offer substantial depth, breadth, and coordination, improve our outcomes through expertise and volume, offer value to the community. We actually, between us and children, we do a pretty good job of taking care of kids. We could do a better job together, and we could probably do it in such a way that people wouldn't feel a burning need to run their own tertiary children's services everywhere in the region. If we can, there's a relatively small number of kids that need the quality of services that are provided here. If we can provide those with great outcomes at great cost, well, not at not great cost, at value cost, we're going to help everybody out here. An example of this consolidation, the country of the Netherlands just consolidated all pediatric cancer care to a single children's hospital. Now, it's not a huge country, but there were 3 or 4 really good pediatric oncology centers. They have consolidated all that to one program now. We believe that if we do this, we can, like I said, offer value to the community through efficiency and care coordination, increase the support of the academic mission by expanding our research opportunities, and also through direct financial support, do better in philanthropy than we do now. We're running about $20 or so million a year of philanthropy here. They're running about $20 or so million a year of philanthropy over there. We think together we can not just add that, we can actually maybe double that. You know, let's kick that up to $60 or $80 million a year. So really, then this needs to extend beyond just acute care and focus all on children's mental and physical health. So the idea of really creating a system that works for kids across the state. Challenges, you know, there's no shortage of challenges. The new budgets propose very large cuts in Medicaid. Children are some of the largest users of Medicaid in the United States. A huge cut in Medicaid, a huge cut in children's health. And, you know, this was able to be blocked, at least stopped at this point, but we will see. The new budget decreases NIH funding by $5.8 billion. And I guess what I'm hearing now is the new solution to this is to take it out of the indirect cost pool. So it's a zero-sum game. I mean, if our indirect cost recovery drops from 52% to 40% or 35%, the medical school and the university are going to take the money from somewhere else. It's not going to magically solve this. So this would be a real challenge. We need to expand our research without the CTSA, and that's going to be focused on hires and retention. Space is a huge issue, and I actually apologize to everybody for not being able to deliver on the space we need. We are getting to the point where we're going to have bunk offices pretty soon. It's just, it's hard. There's limited space on this campus. I can tell you, and I can tell you that John Doherty's in the room, we know, and we are looking at ways to improve the space here. It can't be done as just an isolated event, though. It needs to be done within the context of essentially where the academic health center is going to go over the next, 10 or 15 years. And continuing to balance our research, educational, and clinical needs. Continues to be a challenge, but really the work that everybody does here allows this to happen in an excellent way. So I think that is everything I had. And we've got 15 minutes. It's 8:15, so I'm glad to take any questions. So thank you. Questions? Okay. Oh, Dr. Roback. Yeah, so John can speak up in this if he wants, but the thing that's happening right now is essentially going through and looking for a consultant group who will help drive the process forward. So the RFA has been written and has gone out. I believe there were a number of responses from things like Chartis, McKesson, all these companies that do that kind of work. I think you guys have narrowed it down to 2 companies right now. The idea of probably having that answer pretty quickly. I believe they would like to have more groundwork done and really be prepared to have discussion of this at the board levels of Fairview, Children's, UMP, and the Regents this summer sometime. So I think that's where we are right now. There's a lot of moving pieces in this thing, but I think by actually getting a good consulting group in, we can actually get some activity again. It's just everybody that wants to work on this already has a job, and they don't have enough time to do the job they have, so we do need that external help. So I would hope in the summer sometime we'll have a strong direction as to where we're going. John, does that seem like a fair? Yeah, okay. Who else? Somebody else had a question? It must have been the same question. Okay, okay, they're all nodding. All right.
The integration done?
So several. I think one of them is, for it to be successful, ultimately you have to look at redistribution of services, right? So how would moving service to Chicago Avenue impact the vitality of this campus and vice versa? That has to be understood. Big challenge is we are 20%-ish of the funding for the University of Minnesota Medical Center. So 20 to 25% of dollars received here every year come through children's services. To have that drop out of Fairview is a big deal. And, yeah, there would be costs that would be shifted over, but it still supports, it's still a big part of Fairview's margin every year. And we need to work on that. The practice is an issue. Most of the people in this room are common paymaster faculty, meaning you're employed by both the University of Minnesota and University of Minnesota physicians. Through that structure, your benefits are paid through the university typically, their tax benefits. It also ties in your academic rank and award with the University of Minnesota. So figuring that out is a little bit of a challenge. Do we need to look at creating a new 501c3, really a children's like UMP? But if we did that to retain faculty standing, we'd actually need to probably charter that through the Regents. How we incorporate the current private practitioners into a model like this. We're pretty easy. I mean, Kristen Hook was in here, pediatric dermatology is easy to separate out from derm, pediatric surgery and that, and we all work for UMP on our clinical side. Children's Hospital has, some programs that work for them, but a lot of programs that are community-based. And how does that play out over time? None of this stuff is impossible to do because people have done it. So, there are models that, are less than perfect, but they're models of how to get there. But that's where we need to go over the coming months. Brad?
You mentioned moving to Chicago Avenue ultimately, and I know that's been one of the discussions, and that a combined effort would go there. And I just wanted to ask again, why Chicago Avenue and why not somewhere near the football stadium or something like that, in terms of having, from a research academic effort, being right near all of the research that right now we're split across the Mississippi River, and moving another mile away doesn't seem like a good thing for our department.
So I think at first, both Children's of Minnesota and Fairview have invested heavily in facilities. And there was a meeting in February of the CEOs of Allina, Health Partners, Fairview, President Kaler was there, and I'm not sure who else all was there. One of the questions came up, exactly that. Number one, if you're telling us you're doing this to improve value in the community, why do you want to run out and build a new, $150, $200 million children's hospital? Which is a fair question. And then the other question was raised, well, why is the default putting it on Chicago Avenue? There is a strong leaning, I don't want to speak out of school, but I think there's a strong leaning of ultimately consolidating all the adult services on the East Bank. So, that's part of where we are looking to go. This would be a great location as far as I'm concerned. It would be closer. On the East Bank would be even better. Space is going to get really challenging over there on the East Bank. Early on when I was talking about stuff moving back and forth, I was talking about moving back and forth. I wasn't talking about this campus closing off. So I think for many years at first, we'd end up looking at a split campus model, a little bit akin to what Atlanta had to go through with Eagleston and Scottish Rite for a while. Okay, well, thank you all. Oh, that's fine.